Okay, I'm sure other people will trickle in as we get going. So I will just go ahead and kick us off. Thank you, everyone, for joining. Anyone that signed up that wasn't able to be here today, this meeting is being recorded. So all of you that are here and also those that have signed up will receive the link to watch the recording in a couple of days. And then you can share it, post it wherever you'd like. If you are going to post it, if you can tag us, that would be great. So today is our first official webinar, Empowerment Through Education, Mental Health Advocacy in the Black Community. It is a webinar about Black history and mental health in the Black community specifically, presented by Guided Growth Mental Health Services. Talia, next slide, please. So brief introductions here. So my name is Sydney Blackwell Hill. I am a licensed marriage and family therapy associate in the state of Texas, supervised by Dr. Griselda Lloyd, PhD, LMFT. I've got some people coming in. So if I'm looking around, I'm just monitoring the guests as they're coming in and out. I am the owner of Guided Growth Mental Health Services, who is hosting this first event. Obviously, I am a Black woman, a Black clinician, so doing events like these is special to me. As I was on my path to become a therapist, I knew that I wanted to work specifically with members of the Black community, and this is just the beginning of the beginning for me, and I hope to do more events like this. And bring more awareness to the mental health field because I am very passionate about that. For my guest speaker today, we have the wonderful Monica Taylor Desir. She is the board secretary of for the American Psychiatric Association Foundation. She is a doctor as well. Awesome clinician, been in the field for several years. Very excited to have her here today. She has a wealth of knowledge and experience. And there will be a portion later on where she can do some question and answer as well too. Then certainly not least, we have Talia Holmes-Rain. She is my moderator for today. She will be helping with all the tech stuff, everything that you see coming together beautifully, she is responsible for. So shout out to Talia for that. And then I will also turn it over to her so that she can do her own introduction.
Hello, everyone. Thank you so much for joining us today on this very important call. Like Sydney said, it is near and dear to both of our hearts in regards to empowering Black communities through education in regards to how important mental health is. And with you guys joining us in this call, it really is letting us know that others view it as important as we do. And we cannot wait to share this wealth of information with all of you guys. So thank you so much for taking time today out of your Sunday to join with us and learn a couple new things for some and updates for others. Thank you.
Yes, thank you. Thank you. We are so excited to have you here. Let's move to the next slide and we'll officially get started. So these are the objectives for this call today. This is what we aim to discuss, what we hope that you get to take with you. So the first topic that we're going to be covering is addressing the historical stigma and systemic discrimination and how that affects the Black community, how it affects our mental health, how it shows up, what that looks like. Then we'll talk about how to explore how mental health presents itself in the Black community. So signs, symptoms, what to look for. So you could be looking for signs for yourself, for a loved one, for anyone else. If there's any other clinicians on the field, if you work with members in the Black community, this could be important information for you to take home to your own client load. We also want to raise awareness and empower individuals to seek help. We also want to encourage you all to start conversations about mental health in your families and your social circles. So maybe this is something that you've been personally dealing with, but you haven't shared it with anyone yet. So hopefully after today's call, you'll have more reasons and more encouragement to start some of those conversations. We'll also talk about some resources and services as well towards the end of the call. And then lastly, we'll have a review game, an interactive game to kind of go over all the material that we covered, and then a question and answer session as well. So why is mental health advocacy important? I want you guys to type in the chat and give your best guess to answer that question. So why do you think?
I was gonna say, or if it's a little difficult for you to come off, type in the chat, please feel free to unmute yourselves to share your viewpoint.
There is no health without mental health. I agree with that. It is a part of health that I think is overlooked sometimes, or we don't think about it as a comprehensive to our well-being, but it absolutely matters. Anyone else want to chime in? Because mental health is easy to ignore until it's too late. Also very true. Sometimes it can sneak up on you. It also helps to breaks the stigma surrounding it. Yes, both good points. Sometimes you don't know what you're dealing with if you're not educated on what the signs are or what it looks like. You could think maybe you're just in a funk or you're just having a bad day, and it could be something that is not necessarily directed to external factors, but it could be an internal thing that you might need some professional help with. So all good answers. It is a part of our daily lives. Absolutely correct. Okay. Next, Talia, please. Some people do not believe that mental health is a real thing. That's an awesome point. Thank you for bringing that up. We talk about that. And emotional intelligence, good call out as well. So mental health advocacy is essential in the Black community because of the historical stigma and systemic discrimination that often exacerbate our mental health issues. So it's a really big barrier for members in the Black community. It's crucial for us to have these conversations and advocate for mental health so that we can begin reducing that stigma, addressing the impacts of historical trauma and systemic racism, and also improving access to competent care, culturally competent care specifically. Advocacy is also empowering as well too. So as you learn more, as you become more aware, it gives you the tools to share that information with other people and also take better care of yourself. Next slide. So Black history and mental health. So I wanted to focus on Black history in mental health in this call as well too, because as you all are aware, there is a wealth of scholars in Black history, and we have been a part of the mental health field for a long time as well too, whether indirectly or directly. So the first piece of Black history that I'd like to talk about that relates to mental health is the Flexner Report. So the Flexner Report was published in 1910 by Abraham Flexner. It is a report that did a study on 155 medical schools in North America. And the report made a really big wave when it came out because it highlighted that there was a discrepancy in psychiatric education and the treatment of mental illnesses, specifically with Black people. So the report exposed the deficiencies and inconsistencies in psychiatric education and training, which highlighted that there was a need for more improved standards and practices in the field of mental health. John Henryism. So John Henryism is a coping strategy that was developed by African Americans, so Black people, in response to societal stressors, particularly racism and discrimination. It was coined by Dr. Sherman James in the 1970s, who studied the link between social determinants of health and physical health outcomes. So essentially, John Henryism is a high effort coping mechanism that really emphasizes resilience. So you'll see sometimes, or maybe you even heard in your own families, where we just have to pick it up and keep going. It makes me think of Erykah Badu's Bag Lady and how we just have to keep going and we carry whatever we carry. But at the end of the day, we're expected to not give up and have that persistence and that perseverance. But it ultimately really reflects the struggle that Black people go through against racism and inequality and oppression. And it demonstrates strength and resilience of the Black community in the face of adversity. But it could also be a sign that we're asking for help as well too. So Black Lives Matter, BLM, most of us are probably familiar with this. So this is a movement that really started to pick up speed and gain momentum in the early 2010s during the trial of George Zimmerman and the shooting and death of Trayvon Martin. And since then, there's been many other shootings, many other marches and activism done in the name of BLM. And it really has highlighted our collective trauma as a people, but it's also made a really big push for advocacy and activism as well, too. And I think we've had some really great conversations and resources be born of the BLM movement. Next slide. So, how does systemic racism affect us? Next, Talia. So, centuries of systemic racism. So, think of slavery, segregation, Jim Crow, just discrimination in general, have resulted in intergenerational trauma. There's some really great research on epigenetics and intergenerational trauma that has linked how carrying this collective stress, this trauma, the impact of trauma being stored in our bodies and how we pass it down from generation to generation, how it can affect our perspective, how we navigate the world, how we see the world. All of those historical injustices and collective trauma can impact our mental well-being, and it contributes to feelings of anger, grief, and mistrust. So microaggressions are another type of discrimination and racism that can take a toll on mental health because it causes chronic stress and anxiety, and it gives you feelings of invalidation. It can also make you feel powerless or make you feel confused as to, am I making this up? Am I reading into things too much? Is this something that's really a problem that's actually happening to me that I'm experiencing? Those constant stressors can lead to an increased risk of mental health disorders such as depression and anxiety. Black individuals and Black people are also disproportionately exposed to traumatic events and violence due to systemic inequalities in areas such as housing, education, and law enforcement. These experiences are traumatic, and they can lead to higher rates of post-traumatic stress disorder, anxiety, and other mental health conditions. I think it's also important to note that you're at a greater risk for suicidal ideation as well too when you have that chronic stress and those constant stressors. Systemic racism has also created barriers in accessing mental health services for the Black community. So that's limited availability of culturally competent care, lack of insurance coverage, stigma surrounding mental health within the community. And then also there is sometimes a shortage in clinicians that are either well educated to work with the Black community, or they have their own biases that prevent them from effectively working with the Black community. Internalized racism is the acceptance of negative stereotypes and discrimination that can have detrimental effects on one's self-esteem, self-worth, and mental health in the Black community. Coping with societal messages that devalue Black identity can create internal conflicts and contribute to psychological distress. So when you're out in the world and you're constantly facing systemic racism, microaggressions, all of these external stressors, it can take a toll not only on your mental health, but also your relationship with yourself. So you may look at yourself differently. You may feel like you're not good enough. You may feel like you're limited in what you can achieve because you're up against so many barriers. You may struggle to be taken seriously in the workplace or for your voice to be heard. All of those things can start to have a negative effect on you and can be related to internalized racism. So this last one is distrust in institutions such as healthcare, criminal justice, and education systems. I know sometimes we joke and say things like, we know that we can't trust the police, or there's all types of different songs or jokes or memes that I'm sure that we've all seen, but that's actually rooted in systemic racism because in past times, especially in history, there has been a lot of times where we were not able to trust those that were in those positions because they either didn't take our care seriously, or they told us that our concerns were not important, or we just didn't receive help at all. So that distrust in the police, or distrust in going to the doctor, or even sometimes government organizations like Child Protective Services, or getting resources from the state, all of that can lead to Black people not asking for the help that they need because of those concerns. So why don't we ask for help? I want you guys to type in the chat or unmute yourself if you're comfortable to ask or to answer this question of why do you think that Black people or members of the Black community are resistant to speaking up and asking for help when they think they might need it?
Because you may be viewed as being weak.
Absolutely. You may feel that someone will think that you're weak and you should be able to handle this on your own. Why do you need help? Anyone else? Yeah, you don't want anyone to know. It's a private issue sometimes, but you have to be honest and vulnerable to receive help sometimes, and that can be scary. Anyone else want to chime in? Okay, next slide, Talia. So the perception of strength. So this kind of goes back to the John Henryism and then the Erica's Badu bag lady is what I like to think of. So there's that strong emphasis again on resilience and overcoming adversity. So we're expected to persevere. We're expected to take whatever comes at us and turn it into something good, turning nothing into something all the time. And those mental health challenges are often viewed as weakness or a failure to cope. So it could defer individuals from asking for help because you don't want to be seen as weak. So the fear of judgment. So that stigma that Monica mentioned. So you don't want to be seen as that there's something wrong with you or that you're broken. So it may stop you from being honest with friends and family in your community because that judgment is too scary or it's too much to deal with. Spiritual beliefs. So sometimes in the Black community, many individuals will think of mental health issues as just like a spiritual battle. So they'll tell you, oh, pray on it, or go to church more, reconnect with your faith, instead of giving the advice of maybe you should seek out professional help or you should reach out to a therapist or a counselor. Masculinity norms is a big one. And this is even outside of the Black community, just men in general, with the expectations for them to be stoic and self-reliant. It really discourages them from expressing vulnerability. So when they need help or they're struggling, they're less willing to be honest about that. They might believe that their struggle is their own struggle. And if they share that they're struggling with something, it undermines their masculinity. So you're less of a man if you ask for help. Distrust of medical institutions. So similar to what we talked about in the last slide, after historical cases of abuse and discrimination in healthcare, it's really, as a result, has had this deep-rooted mistrust of the medical system in the Black community. So there's a skepticism that's involved where you may want to ask for help, but you're not sure who you can trust. Family dynamics. So talking about mental health issues is normally discouraged within Black families because they see it as a private matter. So they don't want anyone in the business. They want to keep it in-house because they either attribute it to spiritual beliefs or they don't want to be judged or they don't want to seem as if they can't cope with whatever they're dealing with. So there really is kind of like that blanket thrown over the issue where we have to keep that in-house and this isn't something that we discuss outside of the house or outside of the family. Then the last one is a lack of awareness. So in some cases, people just simply are unaware that they can ask a mental health professional for assistance. Maybe they're not sure of how to find a therapist or where to begin, or they have questions about the process overall and they're not sure who they can trust, or they just don't know what direction to go in. So some statistics on Black mental health. So according to the American Psychological Association, or the APA, Black adults are more likely to experience serious mental health disorders, including depression, anxiety, and post-traumatic stress disorder, compared to their white counterparts. A survey by the APA in 2020 found that Black Americans are more likely to report feelings of stigma associated with mental illness, which makes them less likely to seek help. Approximately 63% of Black Americans view mental health as a sign of personal failure. So they're internalizing the fact that they need help rather than asking for help. A 2021 report from National Alliance on Mental Health Illness stated that only 1 in 3 Black adults who need mental health care receive it, reflecting significant barriers to access, including economic, systemic, and cultural factors. During the COVID pandemic, the Centers for Disease Control and Prevention, the CDC, reported significant increases in anxiety and depression symptoms, particularly in the Black community. A survey in late 2020 indicated that 40.5% of Black adults reported symptoms of anxiety and or depressive disorder, compared to 30.9% of white adults. So almost a full 10% discrepancy. A 2021 study published in the journal Psychiatric Services highlighted that less than 25% of Black adults felt that mental health providers understood their cultural backgrounds or experiences, which can impact the effectiveness of treatment. I've personally seen that with my own caseload. They make comments like, it's good to see someone that looks like me. It's good that I don't have to explain certain things about my childhood or my experiences because you get it. According to the CDC, suicide rates among Black youth have significantly increased in the past decade. Data from 2019 indicated that suicide is the second leading cause of death among Black youth aged 10 to 19 years old, with rates rising more than 60% from 2001 to 2017. And I think COVID had a lot to do with increasing the suicide numbers as well, too. So what does mental health look like in the Black community? So I'll ask the audience again, if you guys can type in the chat or unmute yourself, what are some of the signs and symptoms that you think would be present in someone in the Black community that might be struggling with mental health? Being mad all the time at everyone and everything, acting out, increased violence, all good answers. So more irritability, less patience. Anyone else? Black men, yeah, a sign of weakness. So maybe that could be possibly like a sign of depression or internalizing shame or feeling guilt. Talia, go ahead and hit it. So isolation and withdrawal. Go ahead, you can go through them. Irritability, anger, disassociation or disconnection. So that's a big one that I see as well too. So, and I also see it in the young men. So not caring about anything, nothing matters. They don't want to participate in anything. That's a big sign, that disassociation and that disconnection. Physical symptoms such as headaches, muscle tension, or stomach issues, being connected to your body and noticing any physical discomforts could be a sign as well too. So being consistently down or sad, a hopeless feeling for an extended period of time without clear reason is another big sign as well too. Sometimes in Black families, we could say, oh, you have an attitude, or she's in a mood today, or she's feeling some type of way. Engaging in excessive or risky substance use, such as alcohol or drugs, as a coping mechanism. This is another one to watch out for Black youth, especially because it's so easy now for kids to get involved with these types of things. But even for adults, if someone is engaging in really risky behavior or substance use or any type of maladaptive, excessive coping mechanism, that could be a sign as well.
We also have two more in the chat. We have a chronic disease as well as a distrust of mental health spaces.
Tell me more about chronic disease. What did you mean by that? If you could type or unmute yourself.
I'm going to take a swing at it. I wasn't the one that put it in the chat, but I'm going to assume that the user may have meant with chronic disease, high blood pressure, high cholesterol, things, stressors that show up in your body, diabetes, stuff like that, using things to cope.
So more of a somatic experience, so physical manifestation of internally what you're feeling. Yes, all chronic illnesses definitely can be a sign of a mental health issue for sure. Expressing thoughts of self-harm, suicide, or engaging in self-destructive behaviors that indicate a heightened risk of harm. Good input, guys. So why should we talk about mental health? Anyone want to take a stab at this and throw out some reasons as to what do you stand to gain when you are honest about what you're going through and that you need help? I see Simone, you got your hand raised. Yeah.
You can go ahead.
You realize you're not the only person going through it.
Yeah, absolutely. When you are dealing with something quietly, it can start to feel like maybe you're the problem or you're the only one that's dealing with it. But when you share that with other people, you may find that they have a similar experience to you. Maybe they can share in what you're going through, or they can help you get through what you're going through. Recognizing negative patterns of behavior before they become ingrained. Absolutely. So speaking up when you feel that something's wrong and maybe it can change your life or it can help change someone else's life. And I saw one more. Mental health is just as important as physical health. Talking about mental health normalizes it. Yes, exactly. So that's also part of the reason why we're here today, to help try to normalize the conversations about mental health and signs and symptoms and why it's important. The more we talk about it, the more people will be informed. Absolutely. So the more noise we make, the more resources we share, the more that we highlight these conversations, the information gets out there, people become more aware, they become more educated, they become more willing to have these conversations. By openly discussing mental health within families and social circles, individuals can break the silence and stigma surrounding mental health issues. It can create a more supportive and understanding environment or community where people feel comfortable seeking help and sharing their experience. Exactly, Douglas. Boom. Hit it right on the head. Sharing personal stories of mental health challenges and recovery can humanize the issues and help individuals see that they are not alone in their struggles. This can foster empathy, connection, and a sense of community support. Encouraging open discussions about mental health can help normalize help-seeking behaviors, so help more people to be brave enough to ask for help and seek out that help. Reduces the stigma as well too associated with seeking mental health treatment. It can help motivate individuals to prioritize their well-being and access appropriate care when needed. So having a more holistic view of your well-being rather than just thinking about your physical health. Now you're thinking about mental and emotional health. And conversations about mental health within families and social circles can inspire advocacy for increased resources. So the more you talk about it, the more gaps in care that you can find. We can come up with innovative solutions and ideas and build more community resources for other members of the community. So now we are in the resources portion. So I've given you a lot of information, a lot of history about Black history and mental health, signs, symptoms, systemic racism, how it affects us, and also some statistics. But now I'm sure you're wondering, okay, that's great. What can I actually do? So this is why we have Dr. Monica Taylor Desir with us today. She is going to talk about resources that are accessible for everyone. Most of these resources are free, and she'll tell you how you can use them and when they're appropriate. So a little bit about Dr. Taylor Desir. She is the American Psychiatric Association Foundation Board Secretary. That's a mouthful. She is the philanthropic arm of the APA, which works towards the mission of a mentally healthy nation for all, where we live, learn, work, worship, and play. Dr. Taylor Desir works as a community psychiatrist for the Olmsted County Assertive Community Treatment and Evidence-Based Practice, where she provides care to persons with severe mental illness in their homes or other community settings. Dr. Taylor Desir recently completed 5 years of leadership as a co-chair for the Equity Diversity Committee for the Mayo Midwest Department of Psychiatry and Psychology. She graduated from the University of Cincinnati College of Medicine. She completed her psychiatry residency and a fellowship in community psychiatry at Emory University. She's a member of the Health Equity and Racial Justice Community of the Minnesota Psychiatric Society, and also serves on the National Network of Depression Centers Diversity, Equity, and Inclusion Work Group. I'll hand it over to Dr. Taylor Desir, and she has some awesome information for you.
Thank you, Sydney. Good afternoon. I'm so happy to be here with you, and happy Black History Month. This is an awesome discussion. I am so honored to join you. And today, really, my purpose is that you if you did I go out for a little bit?
It did go out for just a moment. We can hear you again.
All right. So my purpose today is that you walk away with some tools that you can identify if you're struggling or you see some others struggling with their mental health, and how to connect them to care. So we will talk about the Mental Health Care Works campaign that has been sponsored by the American Psychiatric Association Foundation. I'll talk to you about 988, the use of mental health crisis centers. If you're going to use an emergency department, what to expect when you go to the emergency department, and other resources. Next slide. Thank you. So, like I said, the American Psychiatric Association Foundation started a public health awareness campaign called Mental Health Care Works. And, why did we decide that's something that is important? Well, as we talked about already, many people are still reluctant to seek mental health care, or they don't know where to start. So we did a survey to define the need for change. And some of those key findings were that about half of the people report that they've experienced a mental health issue, whether that's depression, anxiety, post-traumatic stress disorder, bipolar disorder, or eating disorders. And 68% of people believe that there is marginalization associated with mental health in the US. So that stigma, like if you got a mental health issue, oh, you go over there, or you don't get the appropriate care that you need. And 44% of people don't believe mental health care is effective. But 60% of people feel that going in to see a mental health professional is not straightforward. Like they don't know how to get in there. Next slide. So most of the respondents, almost 80%, were aware of mental health services in their area, but many are not comfortable seeking mental health, and that included men, those persons who are older, those who are less educated, that only had schooling up until they're 18, or those who worked part-time or were self-employed. In comparison, 45% of the respondents who were uncomfortable are not likely to learn more. They're like, I'm not comfortable with mental health, and I don't want to learn anything else. Next slide. So the Mental Health Care Works campaign has vignettes and little videos that they've done. And I'm going to put the website in the chat. And one of these is Simone. And we're going to look at this little video of Simone.
When I first had Jaden, I'd get comments all the time about how happy I must be. I remember thinking there must be something wrong with me because I don't feel all this joy I'm supposed to be feeling. It was hard to admit that, even to my doctor, but she told me it was postpartum depression and that is very treatable. These days, things are feeling right, even if they don't always go that way.
Mental health care works when you make the call.
Thanks. So one, we highlight different vignettes, and there's, you could go and see different people from different backgrounds. But the one thing we want to emphasize is that mental health care works. Mental health is treatable, and you have to reach out to get that support. We are encouraging people to first talk with their primary care physicians. And that might be the easiest way to get in and start the conversation. But again, it only works if you make the call. So that's making the call to your primary care provider or physician. So what if you're in a crisis and you need to talk to somebody now? So how many of you, I think we can do, just if you just put in the chat, yes, no, have heard of 988? We've got a no, and I'm always surprised when I hear that people do not know about 988. It's been in existence for about since 2023, and it was previously known as the National Suicide Prevention Hotline. It is 1-800-273-TALK, but we needed a shorter number and a way for persons to reach out and get mental health care and not be connected immediately with like police and EMT, because we have seen in the media what can happen when people, especially Black people, call for mental health care and then they end up injured or they end up dying because of their encounter with the police when seeking help. So 988 was created to provide access to care and to increase access to care. You can call that number instead of 911. It's 988. You get connected to a counselor. You can call, text 988. You can do a chat. There are services for those who are deaf or hard of hearing, and there are specialized services for the LGBTQIA population and for veterans and for Native Americans. It is free, it is confidential, it's judgment-free care, and connecting with someone can help save your life. So with 988, if you heard about some challenges before, just recently, like since December, they are now using geo-routing, which means from where you're calling, they will connect you to the nearest crisis center, some to where you are. Previously, they were using your area code. So like my area code was still from when I lived in Arizona, and then I live in a different state. So that wouldn't be very helpful. So now it's geo-routing. And the reason why we encourage the use of 988 or the use of crisis teams is that really they can help solve the problem a lot of times over the phone, help do some crisis management, direct you to other resources if you need to go into the hospital or to crisis care before having that interaction, just as an assumed interaction with law enforcement. So what I'd like to do is just play a clip of what you might hear when you call 988.
You've reached the 988 Suicide and Crisis Lifeline.
Para español,
marque el número dos. If you are a veteran or service member or are calling about one, press 1. To connect to support for LGBTQI+ youth and young adults, press 3. Otherwise, to talk with a counselor, stay on the line or press 0. To improve 988, your call may be monitored and recorded. We are checking for a counselor who is available to talk. You'll hear music while we do this, and we'll give you an update in 30 seconds. You are not alone. We care and want to support you. Someone will be with you soon.
Thank you. So that's what it sounds like. You have your options, and then they'll connect you to someone that's closer to your area. Next slide. So I like to talk about the use of mental health crisis centers. When I see patients that are in a mental health crisis, but maybe not acutely suicidal, or maybe they're having some suicidal thoughts, but not feeling like they're really going to act on it, and they need to be in a safer place, sort of monitored, I recommend using our local crisis center. And this is a picture of what it looks like this is the Southeast Regional Crisis Center in Rochester, Minnesota. When I say crisis center, even to medical students, what is your immediate thought? They're telling me, it looks like a jail. It might be someplace with fencing and locked doors, still building. And it's like, this is what it looks like. It's very welcoming, and sometimes it can be more welcoming than the emergency department, because emergency department has everything. There might be medical emergencies coming in, traumas, lots of people waiting, especially if it's like cold and flu season. And usually the mental health crisis centers are just for mental health. So it's usually shorter waits. You're getting triaged quicker. I always say it looks better for our crisis center. There's like blankets and like lounge chairs. And a lot of my patients like this because it's not a fully locked facility. So if they want to leave and go smoke, because that can sometimes be really important for some patients, that they are able to smoke cigarettes, they're able to go out, or if they need to take a walk, they can go take a walk and come back. So this will provide immediate support and intervention. It's 24/7 access, just like an emergency department. So really there's no wrong door. So let's say you have a mental health crisis center in your neighborhood and you're worried that, what if I go there and that's not the right place? There's no wrong door. So you could come in and they would connect you if you needed to be in the emergency room, or if your symptoms are so severe at the time that you need to be in the hospital, they will connect you with them. It's usually less than 16 beds, so it's a smaller facility. There may be children and adults. This particular one has children and adults in 2 separate wings. They'll do a risk assessment. They may connect people with social work if they need like insurance or housing resources, and they provide tools for emotional stability. Next slide. So what if you're saying, Dr. Taylor Desire, I don't even have one of those. I would just have to go to the emergency department. Or some people are feeling like they really need that help from a physician or an inpatient stay, and they go to the emergency department. What should you expect when you get to the emergency department? Remember that it's physical health and mental health, so they're going to triage you. They're going to see why you came in and which is more important at that time. So they may come in and you say, I'm here, I'm not feeling safe, or I'm having a lot of panic attacks. They will then decide which area that you should wait in. Do we put you in the back? But wait, there's someone having a heart attack and we don't want to put you in a place where everybody's running around. So they may ask you to sit up front. Some hospitals have specific like psychiatric emergency services. And some will just have no services and a psychiatrist on call. So someone will do an assessment. They'll probably be a social worker, or it may be, if you're in a teaching hospital, it may be what we call a resident physician. So someone who's finished medical school and now they are in their specialty training. It's pretty common to think if you're in one of those teaching facilities that you may be seen by 2 or 3 people. So when I work at Mayo Clinic and I go in, I know that they've been seen by a social worker, been seen by maybe a medical student, a resident. Great, we have all these assessments, but if you're depressed, irritable, mad, not doing well, how many times do you want to answer the same question? So I try to come in and say, I'm not going to ask you the same questions, really just need to know these important things. They will decide an intervention. That may mean what type of medicines may be helpful for you. Are there some therapeutic ways that we can talk through things? Short-term CBT, help you safety plan, most likely. And one of those safety plans that I always think about is called My 3 app. And I'm going to put this in the chat too. Because right now, hopefully people are doing well. I know there's a lot of stuff going on in the world today that can be stressful, but I always say when you're in a good place, write down your safety plan. Write down those 3 people or use the My 3 app of people that you can contact. Do it when you're in a good space, because when you are stressed, in crisis, your brain's not working properly. And it's like, oh, I can't remember so-and-so's phone number. I don't know how to reach so-and-so. I can't find my paper. So I used to put it out on paper for youth and I would say, put it on the refrigerator or put it in your bathroom mirror so you always know where it is. They may do some medical tests to make sure that if you're taking medications, your medication levels are appropriate. If it's hormones, that your hormones are appropriate. Most of the time, they will, I'm going to say 95% of the time, and you're in the emergency department, as protocol, they will do a urine drug screen and a pregnancy test to make sure no medicines are affecting a potential fetus, and also to make sure that any medicines they give you are not interacting with any substances. So there are several dispositions they could decide. They could decide it would be better for you to come into the hospital. Let's treat you, get your medication stable, get you started on some medicines, or look at other treatments. They may recommend that you follow up with an outpatient clinic where you would see a physician, a nurse practitioner, or your primary care doc. They may recommend that you go to a crisis center, which is shorter term. So that crisis center that I presented, people could stay up to 10 days. And I also forgot, they could say, we've done a safety plan, you've identified people that can help you, this is a short-term crisis, you could go home and then connect with a therapist like Sydney. And hopefully what should happen is Sydney would get some information that said, you know, Miss So-and-so had an ED visit and we recommend X, Y, and Z. The next slide. So now that we've gotten to the counselor, because we're through the acute crisis, really you want to have some questions to ask to see if this counselor is a good fit for you. So it is a working relationship. So when I tell people you're going into therapy, therapy is work, and it's good work because it's a commitment to yourself. But then just like we go throughout the world, sometimes not everybody is a good fit as a friend, or even, you know, there's some coworkers you might have that's not a good fit. So what kind of questions should you ask? Here are a list of questions, like what types of therapy do you practice? Like cognitive behavioral therapy, trauma-focused, CBT. Some people might say talk therapy. You might want to ask them what that means. Interpersonal therapy, family dynamics. Ask how often that you will see your therapist. Because sometimes there's always like a mismatch in expectations. Somebody might think they're coming in once a week, and that therapist has a large caseload and can only see you once a month. Now, if you're really in crisis, you might need to look for somebody else. Ask if you do both live and video visits, especially if you need that flexibility. You don't have the time to drive back and forth from work. I've had people, especially at the crisis center, that would see me, do some follow-up with me, and then like, where are you? They're in their truck taking a break from work because they couldn't drive all the way back to the crisis center. Ask, what about missed sessions? Some practices, if you miss like 3 sessions, no call, no show, then you're not a patient anymore. And you didn't realize that. So you need to ask about missed sessions. Are you paying for missed sessions? Especially if you don't call to cancel. Ask, when will I know that I'm near the end of a therapy course? So if you think way back on some of those cartoon-like pictures of people laying on the couch, and Freud in the background smoking his pipe and the cigar, and you talk about your life that could last forever. You want to know how long you might be there, how long, or what are some signs that therapy is working for you. It also helps you to set some goals of what you want out of your therapy. Make sure you talk about cost. Will your insurance cover it? Do you want your insurance to be involved? Ask what type of license the therapist has. So, like Sydney's a licensed marriage and family therapist. There are psychologists. Some psychiatrists do talk therapy and psychoanalysis. We have social workers. So you want to make sure that you know what type of license that person has, and talk about, does what we talk about remain confidential? Because there are some things by law that we will need to contact somebody. If you come in and you're so angry and you really want to go harm somebody, we will talk more about that. And then we'll have to see if we need to talk to somebody or if you are being harmed. The other thing to think about is, was I heard and respected? So you want to make sure that the therapist is working with you. The fact is, there's only for psychiatrists, there's only 2.5% of psychiatrists are Black. 3% of psychologists are Black, and we know there's a great need in our community. So it is likely that you will have a cross-cultural therapist, someone that looks different than you. But are they working to hear you, understand you, and do you feel respected? So do the counselor effectively communicate with me? And then are my strengths, beliefs, cultural practices incorporated into the treatment plan? I think this is important. Not everybody will do that. It's something that you need to talk about, but I like to work from a strengths-based position. You are still here. You walked into the office, no matter what is going on, you have some types of strengths that have gotten you here. And let's see how we can build on that. Is there a faith that's important to you? Is there a cultural practice that's important to you? And one really big thing is, how do I reach you when I'm in crisis or after hours on weekends? Will they have a pager? Do they have an answering service? Is it that you would need to go into the emergency room, or you need to go into a crisis center? But that's important to know, especially if you're working with someone, maybe you hit a bump in the road and then you're like, how do I reach this person? Next slide. So I will be here for some questions. If you have any, this is my email where you can reach me. What I will say is, if you send me an email, make sure you say mental health webinar question, because I get 1,000 emails and then I'll forget, or it'll go into another area. So just make sure that you put mental health webinar question, and then I'll put that to the top.
Right. Thank you so much, Monica. That was wonderful, wonderful information to share that I hope if you didn't know before, now you know, and if you could share with someone that you think may need this information. This is all wonderful information to keep circulating. And I did put your email in the chat as well, too, for anyone that may want to reach out to you via email.
Thanks.
Next slide. Okay, so now we're going to do a little review game. So if you are on a computer, you should be able to either type in the link or scan the QR code on your phone, but it should be able to work on your phone as well too. Thank you, Talia, or moderator, just drop the link in the chat as well too, so it might be easier to just click that. And then we'll wait until a few people join so that we can review what we learned today. Okay, we see the players are coming in. I like Bronze Horse. That's a good nickname. Good, good. Get a few more. Wait, maybe like a few more seconds, see if anybody else wants to play.
So we got 5. So far, we got 11 attendance. We're almost halfway there, guys.
Anybody else wants to join? Last call. All right, let's go ahead and kick it off. I can't hear any sound if there's sound supposed to be playing.
I didn't do it with the sound.
Oh, no problem. All right, so which movement highlighted collective trauma? Let's see how many of you get it correct. Lock in your answers, guys. Okay, most of you got it right. Okay, we're off to a good start. True or false? Systemic racism affects mental health. Oh, that was fast. True or false? The Flexner report improved psychiatric education. You guys are quick with the true or false. Everybody got points on that one. Okay, Iguana, I see you. 3 in a row. What is John Henryism? Okay, so 3 of you got it right. That one's kind of like a trick. It's like trickly worded too, so I can see how you might have thought it was something else. Iguana's on fire. Why is mental health advocacy important? Good, everyone got that one. What does BLM stand for? This should be an easy one. Which barrier to mental health care? All right, music. All right, everyone got that one right. Love it. Okay, we got Groovy Eagle on fire now. Which is a mental health resource? Well, that was fast. Okay, a few more questions. Which is a symptom of depression? That was fast. You guys are really fast. What is intergenerational trauma? True or false? Microaggressions can cause chronic stress. True. Answer streak of 11 is crazy. What is internalized racism? Awesome. Everyone got that one right. Amusing deer. We got some fire. Ooh, streak of 12. Ooh.
Listen, they better come after Deer because Deer has been in the lead the whole time. Y'all got
They
3
are.
more to go. Gotta be a little quicker. We gotta get Deer on the heels.
Last 3 questions. True or false? Masculinity norms discourage vulnerability. I think it's fitting that they put an image with like a superhero with a cape. It's kind of what it feels like. It feels like you're putting a cape on and trying to save everyone but yourself. Oh, iguana moved up. Last 2. Why might men avoid discussing mental health? I see why some of you chose seen as strong. You're thinking that maybe they want to be seen as strong. I see that. All right, last question. Iguana took it towards the end. Let's see if they can finish it off. Why might Black families discourage or avoid mental health talk? Yes, private matter. All right, let's look at the podium. All right, we got Groovy Eagle in 3rd place. Bronze Horse in 2nd place. Who's got the spotlight? Let's see. Came in at the last second and took it home. All right. Thank you guys for participating. Hopefully that was engaging, a fun way to kind of review the information that we've learned today. So just going to briefly check in with our objectives that we started with earlier today. I think we hit everything. If you guys have any questions about anything that we've covered, we're going to move into the question and answer portion of the call. I think Monica still has some time to stay on with us. So if you want to unmute yourself, you can, or if you want to put your questions in the chat, we have a couple of minutes that we can kind of have a conversation with you guys. And even if you don't have questions and you just want to share something that you learned or your personal experience with mental health or even Black history, because happy Black History Month, then we can have that conversation as well too. So I'll open the floor to you guys.
It's a shy group.
Yeah.
I guess I'll ask one for
I'll
everybody.
ask next.
Oh, go ahead, Mr. Douglas. It's all you.
No, I was just going to make a comment. Unfortunately, I couldn't participate in the questions because I'm driving, but I just wanted to say I thank Monica for the sending over the invite. You guys did an excellent job with the information and addressing some of the, basic information that we need to know, especially myself as a mental health advocate. So just want to say a job well done, and I thank you.
Thank you, Douglas. I appreciate that. I'm glad that you were able to join, even though that you are commuting. Please drive safely as well. But hopefully the information that you got to be a part of today, you can take with you personally and just for other people that you may encounter as well too. So thank you for calling that out.
Thank you for coming. So glad you logged in.
You're welcome.
Anyone else have anything that they want to share, a question they want to ask? You can raise your hand, chat, unmute yourself, whatever's comfortable.
I guess I'll ask something to kind of kick it off. It might be a little bit more personal, and please don't feel as if you have to answer it if you don't want to. As you've been talking throughout this, speaking about how important it is to have Black clinicians, what made you, Dr. Monica, and you, Sydney, decide to become Black clinicians yourself in your adult lives?
Do you want to go first, Monica?
Sure, I'll go first. We talk a lot about representation matters.
Mm-hmm.
And so think about like, who are the people that you see, the people you look up to. And when I was growing up, I had a Black pediatrician, and the woman who lived across the street was a Black pediatrician. So I did not know that wasn't normal. I was like, oh, they're doctors, and they really encouraged me to go into medicine. So I thought I was going to do psychology, and they're like, no, you want to be a doctor. And so I was like, all they do is prescribe medicine, which is not the case, but they were really there to encourage me and help mentor me through the whole path when I did decide that I was interested in medicine. So what college classes to take, what to do as I applied to medical school. So I think that was really important. And then mental health has just been important to me. I also remember that my grandfather had Alzheimer's disease in a time when they did not know what to do with it. So I remember visiting him at the state hospital because they didn't know, we didn't have the medicines that treats Alzheimer's now.
I think for me, a lot of what was the catalyst for me to become a therapist was my own personal experience in childhood, my teenage years, and even as an adult. I struggled with depression and not knowing that I was also anxious as well. I've just now started to realize as I've gotten older that some of the things that I was dealing with when I was younger might have been related to anxiety symptoms. So having those own personal experiences, I really wished that I had someone like myself. So I kind of made like a promise to myself that when I was older, when I was more educated and I had entered the field, that I would remember the struggles that I went through and try to be the person that I wish I had. And I think that doing events like these and letting it be known that I am a Black clinician, I am a Black woman, I understand the struggle. I want to kind of bridge that gap with the gaps that I've noticed in access to care and people not being willing to maybe share about their experiences because of the stigma, or maybe they don't know that what they're dealing with is mental health. So all of those things and my personal experiences have really continued to push me on this path. I hope that answered the question.
Yes, thank you so much, ladies. And I really appreciate you, Monica, for showing how important it is for us, especially in our communities, to have mentorship opportunities, as well as having individuals who have been through it. I think that's something that all of us could use throughout any type of career field that we're looking for, but especially when it is coming to being a mental health professional or mental health clinician, because it is such an oddity to be able to find individuals who look like you and who may have had similar experiences to you to be able to help you through those times. So thank you, ladies, for sharing. I appreciate it.
Of course, that was a good question. We have some more time. Does anyone else have a question or something that they want to share?
Yes, this is Douglas again. I got a question. I know being in this field, based on when you guys first came in until now, there's been a major shift. Mental health has become the buzzword. What has been that shift? And then when we start to talk about Black History, DEI, and how things are shifting now, and let's say that playing field not being equal anymore, or never was equal, what is it that you would suggest? So, what was the shift that you've seen over the years in regards to DEI? What should we do now to keep this conversation going, or what should we do now as advocates?
That's a good question. Thank you for asking that question. I'm newer to the field, but I have noticed that as I was going through graduate school, doing my internship, I did not encounter a lot of Black therapists. And I didn't encounter at the site that I was previously working at, there wasn't very many Black people. So there was still that gap in people asking for help or showing up for services. And I think that with the state of the world, things that are going on in government and politics, it might discourage people from asking for help. But I think in situations like this, there's a bigger push for community and support. So I think that in order to keep these conversations going, you just have to be present and you have to make more noise and remind people that although there is a lot going on in the world, that it's also an opportunity for us to connect alongside each other and create space to build community with each other. And that could look like educating yourself on mental health signs and symptoms, having those conversations with friends, family, people in your social circle, maybe looking into resources. Maybe there's other like free resources that you can join, that you can share with other people, volunteering if you can, and just continuing to educate yourself and sharing as you continue to do that. Monica, do you have an answer?
Yeah, so yeah, you make me feel old now. So I've been in the mental health field for like over 25 years now. And when I said I wanted to be a psychiatrist, my mentors were supportive, but lots of people in the family are like, you want to be a real doctor, right? Like psychiatry wasn't real in the Black community. That's not real. That's not real medicine. But we know that it is, and it's definitely been highlighted, and we need it more. So I think the real challenge is definitely everybody sort of getting on board to diversity, equity, inclusion after the death of George Floyd, and now people seeing our companies back off of that commitment, and even within political rhetoric that mental health and antidepressants, people need to get off that, and people feeling erased in the society no more Black History Month, no more Heritage Months. And that can really wear on your mental health. So we have already talked about systemic racism. So I think the thing that we definitely need to do is to make a bigger commitment to taking care of our own mental health and those in the community, and saying, yes, this care is for me too. It's important for me to have boundaries. It's important for me to take time and take care of myself. And this also reminds me of the quote by Audre Lorde, caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare. Because we need to take care of ourselves so we can continue. We know this isn't a sprint, it's a marathon.
Mhm.
And I do see a question in the chat from Kelly.
Mm-hmm.
Question in the chat is, since you are with the American Psychiatric Association, she had been reading about their 2021 resolution and task force addressing racism and admitting their role in perpetuating racism in science. Wondering what kind of guidance or progress have you seen since this resolution that promotes psychological research on the alleviation, I think. Thank you, alleviation of racial and ethnic injustices perpetuating racism?
That's a great question, Kelly. So within APA, definitely saw more recognition from like the psychiatry leadership and administration as a whole, to make sure that there's more persons and more of color and experiences included in all of the leadership committees. And so that's a lot of like the legislative body. But when we talk about research, we know that funding for lots of research comes from government. And so I'm interested to see how this is going to pan out. We start to see some more research like on microaggressions in therapy. Like how do you navigate that within a therapeutic relationship, whether it's patient to therapist or therapist to patient? How do you mend that? How do you prevent microaggressions? So the work of Monica Williams, and I will put her name in the chat. So Monica with 2 N's, she does a lot of work on that. And right around COVID, there was more work on like racial trauma, especially as it played out and systemic racism as it played out during COVID-19. But I still think it's in the infancy of really studying and doing research on racial trauma. So hopefully that answered your question. Oh, one more thing. There's also been we also talk about the social determinants of health, but there's also what we call structural determinants of health, which looks at policies and procedures that may have been inequitable, and how those affect persons and their mental health.
Good question, Kelly. Thank you. And we are running up against the clock here. So we'll take maybe one more question and then we'll move on.
I see Kelly's question.
Mm-hmm.
Do you think funding will be affected? Yes, Kelly, it's already been affected. So 2 things. There was an executive order affecting government funding and the amount of indirect spending, which is sort of like administrative spending, so you can get things done with your grants and your research. And that was cut significantly Now, I believe it's cut down to 15%. We used to get like 30%. So it was cut by half. So that has affected all of educational institutions and people who receive government research. And then the other executive order was, of course, against DEI funding and initiatives, so diversity, equity, inclusion. There were NIMH grants, the National Institutes of Mental Health grants, that were specific to research with activities relating to diversity. That has been impacted. So yes, I think now we need to look more, if you're moving the research forward, as to alternate sources of funding. And that could be a whole nother webinar.
Mm-hmm. More to come.
You're welcome.
All right, Talia, next slide. Great engagement, guys. Thank you so much. Okay, so where to find us? So we are on Instagram, Guided Growth MHS, Facebook, Guided Growth MHS as well. Our website is there. I'm currently accepting new clients. Also in the future, stay tuned for more events. So more webinars, classes, group therapy, things of that nature. Many good plans coming this year. We're just getting started. This is kind of like the kickoff to introduce ourselves to everyone, but we hope that you connect with us and stay tuned for more. If you have any questions or want to follow up about anything that we talked about today, there is a contact us form on our website that you can utilize, or you can send us a DM on Facebook or Instagram. Next slide. And that is a wrap for today. So thank you all for joining us. I am very grateful to have had the opportunity to work with Dr. Taylor Desir and be hopefully a guiding force in the Black community as I continue to work through my career. I hope to share more similar events like this and make more of a presence for the Black community. And I hope to see all of you again, whether that's through networking or working with you individually as a client, or if you just want to have a conversation. I'm open to all of those things. So I thank all of you today for being here. I hope that you learned something and you take this information with you. And then, like I shared in the beginning, the link to the recording will be sent via email over the next couple of days.
Thank you. Appreciate it.
Thank you all. Hope you guys have a wonderful rest of your Sunday. And remember that rest is revolutionary. So take some time to do something for yourself, even if it's as small as like making that fancy cup of coffee or taking a little bit longer in the morning. Do what you can to take care of yourself. It's important and we need you here. All right, bye, everyone.